Hello, and welcome to our webcast. I'm Jamie Pennington with Moss Adams, and I'm getting us started for today's session, Healthcare Third-Party Vendor Risk Management. Before we begin, I'm going to play a brief housekeeping video.
Welcome, and thanks for joining. We're pleased to present our continuing professional education webcast series. Before we begin, please keep the following in mind. You can customize how you view our presentation and interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can adjust window size and placement or enter full screen mode using the controls at the top right of the window or dragging the bottom right-hand corner to resize. At the bottom of your screen, you'll see a series of icons that relate to a different aspect of our session. You can download a PDF of today's slides from the Slide Deck and Handouts widget. You can ask questions by typing in the Q&A window and clicking Submit. We'll do our best to answer all questions or follow up via email. If you experience technical difficulty, refresh your browser by hitting the F5 key. Today's session offers 1 CPE credit. To receive credit, you must meet the National Association of State Boards of Accountancy requirements. You must attend at least 50 minutes of the session and respond to at least 75% of polling questions. To participate in the polls, please check the button next to your answer within the slide window and click Submit. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon in the CPE Progress widget and download your CPE certificate. Don't worry if you can't download your CPE certificate today. We'll email you a copy in 2 weeks. If attending this webcast in a group, you must complete our group CPE attendance sheet, available in our Slide Deck and Handouts widget to receive credit. Please have all group members sign it and send only 1 sheet per group. CPE credit can only be awarded to participants registered as themselves and isn't available for participants who view the on-demand version. This presentation is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
And now I'd like to introduce today's presenters, Troy Hawes, a Managing Director within the Moss Adams Cybersecurity Consulting Practice, and Kim Hodson, a Senior Manager within the Moss Adams Healthcare Consulting Practice. Their bios and contact information are located in your webcast console for your convenience. And now I'd like to turn the floor over to Troy to get the presentation started. Troy?
Great. So thank you, Jamie, and thank you everyone for joining us today on our webcast on third-party vendor risk management for healthcare organizations. Our agenda really today is to walk through the various vendor risk threats that are out there when leveraging vendors within our organizations. We'll provide kind of an overview of compliance and cybersecurity requirements around vendor risk management. And we'll also provide some best practices that you can implement to manage your vendors and kind of the risks that they might bring to your organization. One thing I'll mention here is want to think about as vendors, third parties, suppliers. They're all kind of grouped together here when we're talking through this. So we'll use those various terms throughout the presentation. We also might use the acronym TPRM, so that's third party risk management, which really is kind of what our discussion is around today. So with that, we do have our first polling question, and we'll want people to respond to this, but do you think your organization has a well-rounded vendor risk management program? So really here, select an answer, hit the submit. That way we'll get answers and give you some time to do this. But we do have a number of things that we're going to cover today. And really the main thing is talking through this vendor risk management program, practices, and risks. also, as we're going along today, if you do have questions, there is a place to enter in questions for us that we can see. We'll help either address those during the presentation or afterwards. We should have a few minutes after the presentation to get to those. Okay. All right, so let's see what people selected. So do you think your organization has a well-rounded risk assessment program? A lot of you did say yes. And then there's always those that are sometimes, and we'll kind of talk through some of those areas today. It's great to see that people think that they have a good vendor management program, and hopefully maybe some of the things that we discussed today will help add even more to that program. For the you that don't know or kind of know or unknown, then really the main thing there is to really think about what we discussed today and feel like how you could implement a program into your organization. So as we get started, what we want to talk about are vendor risks, the threat landscape. So there's a lot going out there nowadays, especially from a cybersecurity perspective, and that's really my side of this conversation, where Kim is really more of the compliance side. But a third-party data breach really occurs when a malicious actor compromises a vendor, supplier, or contractor. Really anybody that you might be using that then affects your information, your data, your systems even. And so the risks around these types of attacks are huge. And healthcare in general uses a lot of different vendors, and we'll talk through some of those later, whether it's around cloud storage, IT services, even medical billing, and others. But these vendors do become a risk, and the more often if they have access to sensitive data, there's even a bigger risk with those vendors. So starting on kind of the left-hand side, reading through this deck, there's a ton of information here. But one of the things that I wanted to point out was the attack types in healthcare from assessment done of 2023 breaches. What the main thing I wanted to point out was those supply chain types of breaches or risks that occurred based off of those attacks in 2023, where that was really around 12% of the breaches there were occurred because of these vendors, these third parties. Other various attacks obviously were around the hacking IT types of attacks, whether it's ransomware or the social engineering using phishing, or BEC is really business email compromise. So there's multiple ways organizations can be compromised through that. And really the other piece to this are just the enormous costs when a breach does occur. Again, research showing that the average cost for a breach with under 500 employees is around $3 million, $5 million for average cost of a ransomware attack, or just at $10 million in general for the average cost of a healthcare breach. And really that's related to the data and the sensitivity of that data held by healthcare organizations. So it is quite significant. It was interesting to see one other article said that 35% of third-party breaches affect healthcare in some way, and that just kind of goes back to the multitude of vendors that might be used in a healthcare organization. So that's big, that's huge, that's large. I mean, that can really affect a lot of organizations. And then the 95% of the largest breaches in healthcare last year were due to a vendor. So again, it just kind of comes back around to what we're seeing, these costs, these risks due to vendors are significant, and they're a need. And so that's why we need to have good practices in place, because we're going to see these costs continue to rise. And we've seen those costs really since 2020 rise significantly. And the more that you think about it, the focus on small to mid-sized businesses and organizations, they're at a greater risk of these types of breaches or incidents, mainly due to whether it's having cybersecurity controls in place or not having enough resources. A lot of times what we see in the headlines are large organizations. They make the headlines when they've got breaches, but we're really seeing small to mid-sized businesses being a focus, being a target as well. And just because an organization thinks that they're small and not necessarily a risk, there is a risk there, and want to make sure that we call that out. And then there was this other, this was an Accenture basically poll that was done of C-level executives, and they really found that 73% of organizations have experienced at least one significant disruption due to a third party. And that disruption was either a breach or maybe just an outage of something, or just an incident. Maybe it didn't lead to a breach, but these things do occur, and that's a large percent just due to third parties. And then with that, probably the biggest thing that we've seen this year when it comes to third parties is the Change Healthcare breach. Whether you use them as a third party yourselves, or maybe you use a different vendor who use them to process payments or do things on your behalf, maybe introducing them as a fourth party risk to the organization. That breach, that attack was significant. We saw that where it affected at least 100 million people, which is almost a third of the United States population. And this has been a significant breach. It's the biggest healthcare related breach that we've seen so far. Hopefully it does not get bigger than this. The other significant piece is just the amount of money that this has cost. So United Healthcare Group, which is Change Healthcare's parent company, they've incurred at least 1.5 billion in direct breach response costs so far, and over 2.4 billion in total cyber attack impacts due to this breach. This also includes the $22 million ransomware payment that was paid. So these attacks are critical to one, mitigate before they do happen. But what they also did was provide us lessons from a healthcare perspective of what do we need to do? What types of controls do we need to be thinking about? And that first one is really an increased focus on third-party risk management. These vendors, these third parties that have a critical service that they're providing to us as an organization, we have to think about, well, how does an impact to their systems affect us? And what does that mean? And we saw a lot of organizations struggle for a while this was happening, where they couldn't make payments. They didn't have good process in place to find somebody else to process things for them. And so thinking about that and how that third party could potentially impact the business is critical. From a cybersecurity perspective, basically really the importance of data security measures. So ensuring that the exposure of patient health information, those types of things, we really have to have good controls in place in order to protect these systems. And especially if that data is going outside of our environments, no longer within our systems, and it's being managed potentially by a third party. Again, how is that third party? What kind of practices do they have? The value of proactive threat detection and response. So really the main thing is that the disruption really caused by the attack underscores the importance of having an incident response plan, or thought through of how you as an organization, if an incident happens to you, what that process would be. But now the incident happens to a third party. How does that affect you and your response to that incident? And really then the recovery or the business continuity aspects of that response and recovery efforts, and really having processes in place to dive into that and take a look at it. Something I always talk about when it comes to cybersecurity in general is security awareness training. Employees are our weakest link when they're falling victim to phishing attacks, and that's really one of the main methods these attackers get access is through these social engineering tactics. And really the thing that we have to encourage and keep on top of is really providing our employees with the cybersecurity awareness training. It has to be kind of ongoing and really providing good methods around that. The other thing, just the cost of ransomware payments. I mean, this can be a huge ethical concern, and really may, and what we've seen, lead to future attacks. There's research out there that shows that people that have paid have been attacked again, and so really have to take a look at what your controls are, so that you don't get hit by this. Or if you do, you've at least thought out what you're going to do. Should you pay or not? That's one of those questions that really should be discussed ahead of time before really diving into, or once you get hit and then having to think about that. Collaboration with law enforcement and kind of cybersecurity experts, and really this is critical, especially when dealing with a ransomware attack or other incident, because law enforcement, you're going to be dealing with them, probably going to be dealing with your cyber insurance carrier, whoever they bring in to do forensics and things like that. Maybe they're bringing in some public relations firm, but you're dealing with all of these different individuals, but these different individuals will have information that can provide a lot of good guidance on how to negotiate, or part of the investigation of what really occurred, and then really helping through the recovery efforts as well. So it's really dealing or collaborating with these individuals to really help you out. And then kind of the last is just the continuous improvement of your cybersecurity posture. So really, when it comes to cybersecurity, you really have to be thinking about continuously monitoring, assessing how we're doing, and really then what we're ensuring that these systems are patched, or we're doing vulnerability scans and understanding where our threats are, where our risks are, where our vulnerabilities are, so that we can then do something about those and kind of move ahead, or ensure that that system is truly secure. And the big thing is really doing or having a third party assess your environment, so you get a different perspective on risks and threats that actually might be out there. Okay, I'll turn it over to you.
Yeah, thank you, Troy. So I think, you were talking about the lessons learned from the Change Healthcare attack, and it's really important to take those lessons and apply it to the broader landscape of risk that vendors can represent. We've talked a little bit about the cybersecurity risk. We also have regulatory compliance risk, and in my line of work, dealing mostly with regulatory compliance, this tends to be one of those areas that is overlooked. Vendor non-compliance can really result in reputational damage. It can open you up to legal and financial risk. It also jeopardizes your risk as an organization to be compliant with standards and regulations. We'll talk a little bit more about that as well. We also have financial risk. So aside from potential legal fines for being non-compliant, third parties can represent a financial risk if they're unable to meet some of their obligations, and that would jeopardize your stability. We also see operational risk, and this really comes in terms of threats related to process distribution. So it's important to have a well-rounded risk management program to address all of the broad range of risks that vendors can represent. I wanted to talk about a few in a little more detail, since there was some recent cases involving third parties vendor risk management. Here we have marketing, debt collection, violations related to disposal practices and BAAs, and licensing. So let's start with marketing. Recently, in October, there were a couple different laboratory cases that came about. Both involved the organization utilizing external marketing services to obtain referrals for those lab services. And where this went awry was those folks were paid per referral, so that triggers the anti-kickback statute. And in that case, they had to pay some hefty fines. Another one related to marketing and utilizing a third-party marketing company was really specific around older adults and senior citizens. So this particular group had some very specific messaging that they were utilizing to try and encourage senior citizens to use this organization's services in exchange for payment. Debt collection agencies, here we see the risk of really exploitation of our older Americans. Into August, just a couple months ago, there was a debt collection company that was specifically targeting older Americans. And in this scheme, they were targeting them for debt collection, debt-related activities, and supplies. And unfortunately, those individuals never received that. So this is a vendor that's working on behalf of an organization that has been caught doing these things. For HIPAA violations, recently a hospital was fined $2.7 million for failing to obtain a business associate agreement for a cloud storage service provider. And within that cloud storage, there was PHI. And in that case, they didn't have a business associate agreement. And then disposal practices. This is an interesting case as we've seen a lot of shift from paper to electronics, but it's important to keep in mind that paper is still out there. And in this particular case, it's still pending, but the vendor is being inappropriate disposal practices, shredding practices that were not HIPAA compliant. And then licensing, if you're contracting with external vendors to help with licensing, it's important to have some oversight of that. One particular case involved a vendor that was being utilized to help with licensing. And unfortunately, folks were not set up correctly. And so what happened when claims were being submitted, they were being submitted incorrectly and for individuals that were either excluded or not licensed appropriately. And so that triggers the False Claim Act, which then again opens you up to financial risk. So I think these cases really illustrate the importance of including compliance as part of that regular assessments that you're doing of your third parties. So I wanted to talk through some compliance and cybersecurity requirements. So I think it's important to differentiate a little bit between a security assessment and a compliance assessment. So security assessment really is there to ensure that there are controls and safeguards around systems and data. So this can also include HIPAA and compliance with standards and frameworks. A compliance assessment, on the other hand, provides the framework for assessing the organization's compliance with regulations. And that can also include HIPAA, but it includes all of the other rules and regulations that govern healthcare from, we talked about earlier, the anti-kickback statute, fraud, waste, and abuse, everything from laboratory improvement amendments to emergency medical treatment. It's there to ensure that you have a way in which you evaluate that. So I think the key here is that compliance helps prevent security issues, and we do that by proactively audit and monitoring vendors to identify what those potential risks are, what gaps there are, and ultimately ensuring that those risks are mitigated or corrected. So I think that brings up the question around why. Why include regulatory compliance when we're looking at security and HIPAA compliance? And I will just give you a personal story. I've worked with a lot of vendors and digital health providers, mostly in the startup space. And a typical conversation goes something like, do you have a compliance program? And then the response I get back is, yes, we've had a SOC assessment or we're high trust certified. And that's great, but is there a compliance program? Is there that framework for assessing risk? And oftentimes the answer is either no, or it's not an effective compliance program. Another reason to consider, looking at regulatory compliance in this process is really it's considered an essential part of your compliance program. So specifically, vendor oversight is called out by the Office of Inspector General within their compliance program guidelines. These were revised recently, November of last year. So if it's been a while since you've looked at them, I'd recommend pulling up their new guide. In the introduction of the guidelines, it says that these guidelines apply to all individuals and entities involved in the healthcare industry. And what it does is it goes on further to say that new entrants into the healthcare industry are encouraged to take steps to ensure they are educated on fraud, waste, and abuse, And here's the important part for me, and they understand the importance of an effective compliance program. So this goes back to my earlier question of why include it. It's because it's of utmost importance to the Office of Inspector General. We kind of see those expectations reiterated when we look at the Department of Justice. They have a guide, a published guide, so you can access this online, that walks them through on how to evaluate a compliance program. And it's a tool that's used by investigators when they're doing their assessment. And it helps them determine whether or not to bring charges or negotiate other agreements during that charging phase. So specifically, they look at this guide. There is a section in there on oversight of vendors. The guide refers to third-party management practices as, and I'll quote it, third-party management practices is a factor that prosecutors should assess to determine whether a compliance program, now meaning you as the organization, your compliance program, is in fact able to detect and prevent misconduct. So they're looking at you to see if you are able to you have appropriate oversight of vendors. It's a clear expectation, and they use it as part of their consideration when they're determining penalties. I do see a question about what guide this is. If you look for Department of Justice evaluating corporate compliance programs, you'll find that online. Also happy to send the link after this call. Lastly, we look at federal, state, and commercial payers. This is where sometimes I get a little bit of pushback because often I'll hear, well, we don't bill Medicare or Medicaid directly, so these things don't apply to us. And my response is usually, these particular programs, even if you're billing just commercial, they're obligated to follow these guidelines meaning compliance expectations and program guidelines, because they do receive federal funding at some level. So either they have a Medicare Advantage arm or there's some other program that receives federal dollars. So I think the key takeaway here is really, while you can delegate services to vendors, the responsibility for ensuring that they are compliant falls on you as an organization. So I'll turn it over to Troy. Troy can talk through some of the cybersecurity regulations that apply as well.
Yeah, thanks, Kim. And really, what we're seeing is there's a number of cybersecurity regulations that are out there that really have some sort of vendor management practices, really to, again, address risks that these vendors or parties can bring to an organization. HIPAA, we're probably all familiar with that, but PCI DSS, so if you handle payment card information, so credit cards, debit cards, things like that, PCI would be applicable to the organization, and they'll have vendor management practices. High trust, if you're looking at high trust certification, or if you're requiring high trust for your vendors, there's a lot of third-party vendor management practices within high trust as part of its risk and compliance program. SOC 2, again, probably something you might use as you're reviewing a vendor and what their practices are. Here again, there's going to be pieces in there that are going to call out vendors and what they're doing for that organization, or how that organization is using that service provider at that point in time, and what types of controls then are in place. The last two, ISO, start off with ISO 27001. So this is basically a cybersecurity framework. It's really a method for we see this a lot with international organizations will have ISO as its vendor, or not its vendor, but its cyber practice. It'll help build out their information security management system, platform, program types of controls, and it's really good about that. And again, more things around vendors here. And then the last one is the NIST CSF, or this is a cybersecurity framework. This is a framework that NIST has put out that really provides good controls for an organization to take a look at how they govern and assess risks within their systems, their technology stack, as well as their management practices and things like that. It goes through a number of different areas to really assess risk, and it's a good regulation. With that, we've come to poll number 2 of 4. And so, does your organization incorporate a review of the vendor's compliance program during the due diligence phase? Maybe as you're onboarding or after you've gone through due diligence? Maybe it's annually or scheduled as something you might do, as needed, or one or more of the above. Give you a few seconds to respond to this. And again, we've got 4 polling questions, so you'll need to answer at least 3 of these polling questions for your CPE. And again, this is 2 of 4 questions. Okay. Give it a few more seconds. Still have a few people that haven't submitted. Okay. So, does your organization incorporate a review of the vendor's compliance program? So, I think the majority of people said probably 1 or the above. So, either probably during due diligence or onboarding, and then the main one probably annually or scheduled kind of as needed, based off of risk. I would say would be a great practice here. And we'll really talk through this in the next phase of what are those best practices when it comes to these vendors. So where we really start out is the whole third-party risk management. There's a whole life cycle around these vendors. So we need to know what that life cycle is, and we've got it kind of mapped out here. And we're going to spend time talking through some of these areas versus others, but all of these are kind of the best practices that you want to have in your vendor management program. And really where you start is kind of in that planning area and third-party identification. So for those of you that don't have a good program in place now, this is really where you start. Is you first off just need to identify who your vendors are, and this is a critical piece, and one we often see from a cybersecurity practice where we hear about shadow IT. And really, this is the introduction of systems or vendors into an organization without IT or information security knowing about it. And if they don't know about it, they can't necessarily secure it. And so understanding where or who your third parties are is really kind of the first step here. And then doing due diligence. You're going through the process, the selection process, understanding the vendors, what they offer, and really having that methodology to assess what they're doing. So a lot of times we see questionnaires used during this process to help get an understanding of what types of controls does that vendor have in place. Then there's the onboarding process, and here's the contracting piece. One thing that I always want to mention is really ensuring that you've got service level agreements established, and then making sure that those are being met by the vendor as part of your ongoing monitoring piece of it. The risk assessment and implementation of controls. So this is really where you understand the risk that the vendor might have in the environment. And we'll talk a little bit more about that, but then ensuring that the controls are in place to help mitigate that risk. We've got inventory and categorization. So we make sure that we have this process to inventory all of our vendors, what they have, what do they have access to, whether or not we're sharing data with them or they're sharing data with us. And again, we're categorizing the risk of that vendor to us and our systems. And then the ongoing monitoring. So this is kind of maybe what we see often is just the annual reviews of controls. So a lot of times we see like people getting SOC 2 reports or high trust reports and reviewing and making sure that vendor still has controls in place. So it's a necessary practice to keep going. And then when we're no longer using that vendor, really having that termination process, that offboarding, making sure that if they had access to data and systems, they no longer have that access, and really getting that termination process done, and getting systems cleaned up depending on the types of access that they might have had. And Kim, I'll turn it over to you to take us into some more of the controls here.
Troy, you mentioned that, starting off with a well-built inventory list is essential. It really is. It should be a documented list that includes, your relationships, how those folks interact with your organization. Having that list is going to help set the stage for your risk assessment and help determine what the extent of the monitoring and oversight you should be performing. So if you haven't already, defined those relationships, we'll just use vendor as kind of our global term there, but realize that, there are suppliers and service providers as well that are perhaps contracted to do very specific things. So once you have that list, the extent of your monitoring and oversight should be risk-based. So what that means is you'll need to evaluate what the potential risk is of each of those vendor relationships. Ideally, you've been involved in assessing for risk from the point of due diligence, but if you haven't, or it's been a while since you've really looked at those relationships, it's probably time to evaluate that. And so I won't go into detail about how to perform a risk assessment. There's lots of great tools out there that can help frame it for you. But really what the purpose is of a risk assessment is to identify what risks there are and how those risks would impact your organization. So once you've gone through that process, you'll categorize those vendors and those relationships from a high risk to, or from low risk to high risk. And then that will feed into how often and what type of monitoring you'll do. So that will bring us to our third of 4 polling questions. So our question here is, does your organization conduct a vendor risk assessment? And so yes, but only during onboarding, which I see is pretty common. Yes, during onboarding and at least annually. No, sometimes, but it depends on the type of risk of the vendor. Or E, unsure. We have a lot of material in our slides today. If you haven't had an opportunity to download a copy of the slides today, you can get that from your control panel where it says slide deck and handouts. We'll also send them via email. Also happy to take questions, and if we can't get through them as we're on our call today, we'll follow up by email. Let's leave it open for just a couple seconds. We have 80% of folks responding. If you're unable to see the poll, try adjusting your window. So where you can, if you're in full screen, try exiting out of full screen. If you're still having issues, we can try and help you on the back end. Okay. Go ahead and close out this poll and see where we're at. Okay, so we conduct vendor risk assessments during onboarding and at least annually. That, to me, is fantastic. I find that it's very hard to conduct risk assessments on an annual basis. I know we get to our security assessments fairly regularly. So consider adding compliance as part of that ongoing annual assessment if you haven't embedded it already. And then depending on the type of risk, that makes absolute sense. When things change, it's important to assess your vendors and see where they're at. So when we left off, we were talking about, ranking your vendors from low risk service to high risk service. Here is, some examples of what is generally, not in all cases, but generally considered to be representative of a lower risk to an organization. So the oversight you do here would be substantially less than what you would do for those services that are more high risk in nature. So generally, high-risk services reflect those that have access to patient information, and they're contracted to perform essential business functions on your behalf. We've talked about some recent cases that highlight the increased oversight of third-party vendors. I shared some cases around sales and marketing, licensing, and credential. Others here have to do with charge capture. There's an increased potential for fraud, waste, and abuse, and as well as those services that fall within IT and cybersecurity that increase your risk of breach and system failures. In fact, so with that said, I was mentioning the general compliance program guidelines a little earlier, and within those guidelines, they say that privacy, security, and breach notification should be a top compliance priority and included on all risk assessments. So if you're not diving deep enough into that area, that would be one of my top priorities for 2025. So we were talking a little bit about when you should look at vendor compliance. Most of us are doing that during the due diligence phase. If your due diligence does not include looking at the compliance program, consider adding that. During this phase of your relationship, it is easier to establish a corrective action when you know what potential risk there is, and working with that vendor to mitigate and address those gaps. Onboarding kind of presents you another opportunity to take a look at the compliance, see if anything's changed since due diligence, and review any corrective actions that you provided during that due diligence phase to make sure that the risk has been mitigated or closed. ongoing vendor compliance management should be embedded in your compliance work plan. We see the increased scrutiny over vendor management and ensuring that their compliance programs are effective, and so those should be included in your compliance program. As needed, when things trigger a need to perform a review, that's an obvious way to assess vendors. Things that might trigger that would be increase in hotline calls, customer complaints. Anytime there's a significant change in regulation and guidance would be another opportunity to evaluate. So we've talked a lot about compliance programs and ensuring that vendor compliance programs are effective. And on this slide, you see what's frequently called the 7 elements of an effective compliance program. So these are the essential things that are expected to be covered in a compliance program. And I won't go through all of them. Happy to talk about them in more detail later. We've touched on a few of them around training and education, specifically, are they getting security training? Have they gotten training in fraud, waste, and abuse? And that there's policies and procedures that are up to date and have been monitored by the vendor. So it's not just an off-the-shelf program, it's something that is really embedded within the organization. So what do you look for when you look at a compliance program? I think the first thing really is assessing whether or not they have an effective compliance program, or is it a program in name only? A lot of groups that I've worked with, it's been a name-only compliance program, meaning we copied some policies and procedures that were available, via the web, and changed the name out. That's not what we're looking for. We're looking for something that really is providing that framework for how the organization is going to conduct business and ensure that they're compliant. Are they checking for excluded individuals? This is another area where we often see deficiencies. One side note, if you are contracted with a vendor to conduct exclusion checks, you're responsible for ensuring that that vendor is checking what they need to check. So state, federal, all of the lists that are applicable, because ultimately you as an organization are responsible for any overpayments related to excluded individuals. A couple others that I'll talk through is, code of conduct. You should be sharing your code of conduct, and they should be sharing their code of conduct. Does that code address things like fraud, waste, and abuse, and expectations to report concerns? Other items to address risk assessment findings, really this is specific to that vendor activity. For example, we've talked about marketing activities. Is there an approval process for messaging? Is somebody in your organization looking at scripts so that you're comfortable with how those messages are being presented on your behalf? Common deficiencies. So these are things that we often work with vendors on, creating a corrective action. First and foremost, we don't see a compliance program. We see really more security programs have been established, and those tend to be formally documented. The compliance, the regulatory aspect of things are less documented, or in some cases non-existent. Outdated or unenforced policies and procedures. Again, this kind of goes back to, taking something that worked for a different company and using it as yours without really taking a look at what that procedure and process should look like. No clear communication plan. So if something were to happen, what is the expectation that they're communicating with you? This goes back to, Troy, your comment earlier around service level agreements. Is there something that's specific around timing of when they communicate with you, who they communicate to? All of that needs to be in place, and it's tested. I cannot tell you the number of times I've called a hotline to just have it ring or not go anywhere. So it's important to test those as well. Also, I've already talked about incomplete exclusion checks. This is where either all the lists are not checked, or individuals that should be a part of that regular screening are not included in the list as well. So once you've taken a look at the program, it's putting all that together. Always make sure that you have that information documented. You never know when you're going to need it. The vendor should be doing a root cause analysis on any deficiency that you noted. Sometimes they just need to provide you with some additional information, but in other instances, it is pointing to further issues that need to be addressed. And taking a look at those corrective actions and making sure that there is that two-way communication as those things get resolved. When needed, it's always important to have an exit strategy so you're not continuing to put your organization at risk. So that brings us to our last polling question. So what do you think is missing from your vendor risk management program? So our options here are, we're missing a good due diligence and selection process. We're missing vendors categorized by risk. Maybe we're not performing regular monitoring and evaluation of our vendors like we want to. Maybe we don't have effective termination procedures. Some of them or none of them, or maybe there's something that should be on this list that isn't included. I'd love to see those comments in the Q&A box. We have about 68% in. We'll give it just another second here. Okay, I'm going to go ahead and close this out. It looks like we have the majority of folks responding. And so we're at least doing some or all of, or we think that some or all of these within this category are missing. I encourage you to take a look at our presentation materials. There's a lot of information in there that can help you make a more robust risk management program. Troy, I'll turn it over to you for final thoughts.
Yeah, so just to close this out, I know we're coming up on top of the hour, but really our summary is vendor risk and compliance management. It's got to be an important part of your vendor due diligence practices, really all about assessing risk and ensuring that we're keeping our vendors and how they might access or have a risk to our organizational data. We're really holding them accountable to that, really leveraging SLAs as part of that. The whole risk management, that due diligence piece of it, there's a couple pieces there, but those practices are critical. And then to kind of just wrap this up, it really remember to evaluate those fourth parties. We have to understand what our vendors are using. Are they using a vendor? And really, does that impact our systems as well? So we wanted to thank you for joining us today. I know we've come up to the top of the hour. I'll pass it back over to Jamie to close us out.
Thank you, Troy and Kim, for a great discussion today. I also want to thank the audience for being engaged and submitting your questions to help guide today's conversation. If we didn't have time to answer yours, we'll follow up with you after the webcast. Also, feel free to reach out to our presenters if you have additional questions. Their contact information is on the screen in your console. There's a number of additional resources in your console that may be of interest to this audience, so definitely check those out. If you met all CPE requirements, your certificate is available to download now in the CPE progress window. A copy will also be emailed within 3 weeks. And finally, here is a link to an online survey for today's presentation. Any feedback you can provide would be greatly appreciated. Thank you for joining our webcast, and we'll hope you join us again next time.